Assalamualaikum and salam sejahtera everyone. My name is Hairul Hasna bin Amali, nutritionist from Center of Nutrition Epidemiology Research. Today, I would like to share with you a research entitled Knowledge, Attitude and Behavior on Salt Intake and its Association with Hypertension in the Malaysian Populations, Findings from MyCoSS Malaysian Community Salt Survey by Baharudin et al. 2021. As for introduction, high blood pressure or hypertension has become one of the main health problems, which cause 9.4 million deaths worldwide. A number of studies have proven that the increased intake of salt was related to an increased prevalence of cardiovascular diseases. Studies in Malaysia have shown rising hypertension over time as well as high salt consumption among Malaysians. As such, we carry out a study to determine associations between knowledge, attitude, and behavior towards salt intake and hypertension among the Malaysian population. The information is important as baseline data for monitoring purposes and developing new strategies and promotional activities on salt reduction in the country. Now we go to the methodologies. The data of the study was obtained from the Malaysian Community Salt Survey, MyCoSS. This is a sampling method for MyCoSS study. The survey used a cross-sectional two-stage sampling design to select a nationally representative sample of Malaysian adults aged 18 years and above living in non-institutional living quarters. It was ensured to cover both urban and rural areas as well as proportionate to the size of the population according to states in Malaysia, which estimated sample size was 1,440 participants. Face-to-face interviews were done by trained research assistants to obtain information on socio-demography, medical report, as well as knowledge, attitude, and behavior of the respondents towards salt intake and blood pressure. The knowledge, attitude, and behavior on salt intake questionnaires adapted from the WHO protocol for population level sodium determination. The questionnaire, which was translated into Malay language and back translated to English to ensure the quality of the translation. So now we go to the result of this study. This table shows the socio-demographic characteristic of the respondents. Total number of respondents reduced to 1,047 after excluding based on exclusion criteria. The results show most of the respondents were female, 55 to 64 years old, Malay, married, have a secondary education, housewife, and household income less than 1,000 per month. This study shows that the prevalence of diagnosed hypertension was 34.1%, similar closer to National Hypertension Survey 2011, which is 32.7%. This table showed the association between the socio-demographic characteristics and diagnosed hypertension among respondents. About 61.4% of the respondents have been diagnosed with hypertension. 83% of the diagnosed hypertension have acknowledged that a high salt diet can cause health problems. Among those who said that they do not take regular measures to control their salt intake, 70.1% have had a hypertension diagnosis compared to 53.3% among those who say they do regularly control their salt intake. This table shows the odds ratio between socio-demographic characteristics and diagnosed hypertension among respondents. This study found those who knew that a high salt diet could contribute to a serious health problem, as well as those who control their salt intake were significantly less likely to have hypertension. In conclusion, by increased knowledge and awareness of the effect of sodium on human health, as well as the behavior of controlling salt intake, is essential towards lowering the prevalence of hypertension among Malaysians. It is recommended to take no more than 5 grams of salt every day in order to reduce the number of deaths related to hypertension, cardiovascular disease, as well as stroke. So this is the references, and that brings us to the end. I'd like to thank you for your time and attention. Thank you.